So this is panel number 4, the last panel of the afternoon. It's been a stimulating day. This panel is entitled Dissemination and Implementation of the Dietary Guidelines for Americans. And our first speaker is Kathleen Rasmussen from Cornell University. Thank you.
Well, good afternoon, and thank you so much to the committee for the invitation and for the opportunity to be here today. I teach public health nutrition, and I've learned a lot today, so this is a nice thing. So today I'm going to talk about an experience from providing an update to the WIC food packages. This is a decennial review. And I want to talk first about our charge. This was an exceptionally long and complicated charge. But the important point here is not only that we're supposed to review and assess the WIC food packages, that's what you'd expect, but they also asked us to make sure that the recommended changes would be consistent with the 2015 Dietary Guidelines for Americans and the dietary reference intakes. So how does one use these criteria together? I don't know about you, but I didn't know. And what happens if the results are discordant? And as you might guess from my asking that question, they just might be. So if we use the DRIs, we have a well-established way to plan diets for groups. And I am going to assume that not everybody in the room knows how to use DRIs to plan diets for groups. So you have to look at two distributions with me. So on the, let me see, where's the pointer? No. Where is the, there we go. Oh, there it is. I just have to find it. There we go. So on the left-hand side is the distribution of requirements in the population in this solid line. And the middle of that distribution is called the estimated average requirement, or EAR. On the dotted line is the actual distribution of the population. You can see I fiddled with this picture a little bit. I'm going to call this the actual intake distribution for discussion. And what you want is that the actual distribution is above the EAR, and you have very few people actually in that distribution of intakes who have a very low intake. And for this purpose, we're showing 2.5%. And 2.5% of the population isn't very many. Now, you might want to choose a different percentage than that, but that's a pretty standard one. All right, so we're going to build from here to using that kind of information to plan diets for groups. And what we're doing in revising the WIC food package is planning a diet for a bunch of different groups of individuals: mothers, pregnant, lactating, postpartum, and infants and children. So this decision tree starts at the top with a group, and it asks the question, does the group have generally similar EARs and energy needs? And I am going to say yes to that question so I can get farther in. And then it says, is the requirement distribution skewed? Oh, let's say yes to that too. And that gets us here to using the EAR cut point method that Bert described a little bit earlier. And you plan for X% to be below the requirement. What's happening at the other end of the distribution isn't our concern at the moment. The 2006 committee that revised the WIC food packages used 5% for X. 2.5% was illustrated on the last slide. So all of this is based on some dietary intake analysis from NHANES, and NHANES consists of 24-hour recalls, 1 or 2 days of it. These are nationally representative at the level of age and sex, but not necessarily at the level of income, and most certainly not at the level of pregnancy or lactation within an income sample. This led to very low sample sizes for our analysis, except for 2 to 5-year-old children, so I'll be concentrating on them. But that's a separate problem that I won't dwell on today. And for today, I will suspend my personal disbelief that we have dietary data of uniformly wonderful and super-duper quality. Now, I have to tell you, I don't do dietary intake analysis for my research because I think it's too hard. So, what happens next? Well, what happens next is we convert that data on food intake via a food composition database, which has its own strengths and limitations, to a distribution of daily nutrient intake. And by comparing those results to the DRI, we can calculate the proportion of the population that's below the EAR, in this case, for a nutrient. Okay, so far so good. What happens when we do that? Well, here are data from the interim report, which we released a year ago. The findings aren't different in our just released report last week, so we'll stick with this lovely picture. And what we see down the left-hand side are all the nutrients with EAR values, and two groups, the pregnant, breastfeeding, or postpartum women, and children from 2 to 5. And it doesn't take a rocket scientist to see that the women here have all those check boxes. So that means for all of these nutrients, more than 5% of the population had inadequate intakes. Not good for the women. For the kids, there are hardly any. Okay, so immediately we have a discordance in the population. That's fine. So now let's look at how we might have that. So aside from the adequacy of the NHANES data for our purposes, women are known to underestimate their intake and consume diets that are not nutrient dense. This could account for many of the nutrients being consumed in inadequate amounts among women in the WIC program, whatever their physiological state. But the data are still a little bit hard to believe because women in WIC receive generous food packages, and these currently meet more than half of women's daily requirements for many nutrients and more than 100% in some cases. All right, so that's where we are with the DRIs. Now I want to switch to the dietary guidelines. In contrast, there is no established way of planning diets for groups in the dietary guidelines, and yet the dietary guidelines are used to plan diets for the entire country. This is a problem. So the first thing we had to think about as a committee is what it meant to be aligned with the dietary guidelines. And from my perspective, there are two practical meanings that were relevant to the WIC program. First, that the food packages cover all or nearly all of the food groups and food subgroups. And this is within the historical precedent that WIC doesn't really offer meat, and the constraint for the food packages to be cost neutral. So that's one reason not to offer meat. The other way to think about it is that the food packages provide the opportunity for participants to meet the dietary guidelines recommendations. But this depends on the quality of the home diet. It may be difficult to achieve a dietary intake that goes all the way to the dietary guidelines recommendation if the home diet is poor. And we're talking about low-income women and children here, so the diet may well be poor. So now let's go back to my picture and see what happens on the other side, which is the dietary guideline side. So here you don't use a food composition database, you use a tool called FPED. And in my long memory, I have forgotten what this means, but it is the tool that finds the potatoes wherever they are in every food, every dish that you might be consuming, and sums those up in cup equivalents per day, the same for the carrots or anything else that occurs in a mixed food. And then you can calculate the daily intake of the USDA food groups, and comparing them to the dietary guidelines recommendation, you can calculate the proportion of individuals not meeting the DGA food groups. And as we've talked about today, the DRIs are related to the dietary guidelines. That's part of how they're constructed. But the relationship is not straightforward, as we've heard, and it may be even less straightforward than I thought. But it also has in it this idea of the USDA food groups that Trish Britton was just talking about, that based on data from the country as a whole, these food groups are constructed, and they modify the relationship between the DRIs and the dietary guidelines. That's not a bad thing, but you should know it's happening before you try and have in your head that the dietary guidelines are going to be somehow in a very straightforward way related to the requirements. Moreover, these food patterns change, as they have several times over the years, so that makes the relationship even less straightforward. All right, so now let's look at that same two groups of individuals, the pregnant, breastfeeding, or postpartum women, and the children 2 to 5, and down the left side here are the food groups. And what we see is a very different picture. Though women are still not doing very well, except for oils, as you might expect because their nutrient intakes were so poor. But look at this with the kids. They were doing so well. And now on the dietary guidelines, they're doing so not well. So not only do we have a difference between the moms and kids, we have a difference between the kids with respect to the DRIs and the kids with respect to the dietary guidelines. Oops. So we can say that when we use when we try to align data on the composition of food groups, it didn't work so well for children. So what could cause this discrepancy? Well, here now we have to look at the food patterns. And this is a list from a paper referred to from the Academy of Nutrition and Dietetics in 2012. This is the 1,600 calorie food pattern, and it's for women my age and children from 3 to 8. So that's the 3 to 5-year-olds in WIC, if you will. So I want to focus your attention on these groups in blue. These are nutrients down the side, and the amount that's in the food pattern, it's 178% of the RDA for protein, 275 for B12, and 160 or 79% for iron and zinc. Now that's way above what 100% of the population needs. So that's a challenge to meet from a typical American intake. For two nutrients with an AI, fiber and potassium, you can see they have very different proportions of the AI that are provided. So now I want to come just to protein. So why would the USDA put together a food pattern that provides 178% of the amount for protein? This is clearly twice what would be sufficient for nearly everyone. Plus, most sources of protein are expensive, and we've been told to eat less meat. So the likely reason is that the DRIs are determined in isolation. The requirement for protein is considered separately from the requirement for, say, zinc. But the dietary guidelines are looking at all the nutrients that are in a food, and the primary source of protein also provides a dietary source for iron and zinc, and we want to meet these requirements in the most efficient way. It's likely to be also true for dairy, which is a prominent source of calcium. So when we look at this challenge, we can see that for children, I said that the results you get with the DRIs and the dietary guidelines are not consistent. And the explanation is probably that children consume relatively large amounts of highly fortified foods, if you think of the vitamin pill-coated cereals, which give them relatively high nutrient intakes. But they're picky eaters, and they're very poor consumers of a wide range of the food groups and subgroups, particularly the vegetable subgroups, legumes, and seafood. So you can imagine how these two might come to different results. So now what do you do? At what point should the committee, that is the committee charged with revising the WIC food packages, be concerned with below recommended intakes of food groups? We know if you have a below requirement amount of a nutrient, we should be concerned because you could become undernourished, but that's not necessarily the same inference for the dietary guidelines. So when we look at these challenges, we recognize that whether you're measuring food groups or nutrients, you are dependent on the quality of the underlying dietary data, and I said that was off the table for today's discussion. So now let's think about the consequences of being above or below the recommended intake of a food group. And I submit to you the consequences of that at the moment are unknown. It's analogous to the situation where the DRI is an adequate intake, or AI. We have no expected distribution of food intakes on which to rely, analogous to what we have for nutrients. And thus, it's hard to know what proportion of the population below a recommended amount is too high. Now, creating such a distribution is a solvable problem, But that still doesn't tell us how much is too much. So if we come back to this picture and look at it again and add a little more information, we see that these two bottom boxes represent different points on the distribution of intakes. When somebody is below the EAR for a nutrient, it's on the far left low side of the distribution. In contrast, when someone is not meeting the DGA for a food group, and that DGA is at the level of the RDA or above, it's on the far right side of the nutrient requirement distribution. So we are asking a committee to try and think simultaneously about preventing people from being too low and categorizing them against a standard that is very high. So it's maybe not surprising that they don't agree for some groups in the population. So now what do we do? I mean, seriously, what do we do next? So we could resort to a decision tree for planning diets. Why not? We could just go right here and substitute DGA for EAR. Why not? I mean, do we have a better idea? I'm being facetious, of course, but could we, find a number for X here that works? The problem is you need an outcome for that, and we don't really have one. And yet I have to tell you, we more or less did something that's like this. So in truth, we calculated the proportion below the recommendation for a given food group and created priority groups based on these proportions. And we treated the priority groups for food groups more or less the same way we did for the nutrient groups when we ran them through a decision tree to decide what to do when we had a nutrient or food group that was too low. And to show you what I mean by this, this is the top portion of our decision tree, and I hope at least some of you can read it. There are two entry points, nutrients and food groups. And if the prevalence of the nutrient inadequacy was less than 5%, we said, stop, we're not going to worry about this, that's below our cutoff. The similar cutoff that we used for food groups was 50%. Not 5%, 50%. Did we have a strong scientific rationale for this? I have to tell you the truth. The answer is no, but we had to start somewhere and give it a go. Now, as you move down through this, you have different proportions of individuals with inadequate nutrient intakes and different proportions of those with intakes below the dietary guidelines recommendations, and you move from lower to middle to high priority. And when you get down to this bottom one on the left, you're looking at a nutrient inadequacy of 50% or more, and a food group recommendation being below a food group recommendation for 75% of the more of the population. These represent some of the cutoffs of the distribution that we had available to us in this committee. We didn't have more information. Now, is this like the most specifically scientific thing we could do? Probably not. But we were using this for setting priorities, for distinguishing among all of those didn't meet the recommendations. We didn't have an unlimited diet. We were constrained to be cost neutral within 10 cents of all the food packages. So we had to make choices. So doing something like this for setting priorities seems eminently sensible. It's reasonable, but it's not perfect. So I can tell you that it seems that what we can say from this is we're pretty clear that a population with 25% of a population with an inadequate nutrient intake probably means something different than having 25% of the population consuming a less than recommended intake of a food group. Which leads me to my bottom line, that it makes sense to expect federal nutrition programs to align their offerings with the dietary guidelines. They are, after all, recommendations for food consumption by the population, and we would like our food programs to be working together with that. However, at present, we lack a validated way to accomplish this alignment. So my bottom line is that better science is needed before aligning food packages with the dietary guidelines can be done with the same assurance as planning nutrient intakes for groups. Thank you very much. And I'm under my 20 minutes.